this time.
Hi, welcome everyone to Basic De-Escalation Strategies. Let's go ahead and get started. We can go to the next slide for just a little bit of housekeeping and introductions. So most of us are familiar with Zoom at this point, but if you're not, I just want to point out a few controls. So as Sarah mentioned and asked, please do mute yourself unless you have a question or a way that you want to participate, just so that there's not a lot of background noise and everyone can hear the presentation well. If you'd like to see your participants on the call, the participants box is on the bottom of the screen along with your chat. So you can talk amongst each other or also contribute to the discussion using the chat feature. And then we also encourage the use of emojis. If you really like something that someone said, it resonated with you, please let them know by using that feature. And go to the next slide. A little bit about us and their presenters today. We are from the Technical Assistance Collaborative. So we're a nonprofit organization dedicated to helping our nation's human services, healthcare, homelessness, and affordable housing systems implement policies and practices that empower people to live healthy and independent lives in the communities they choose. Next slide. I'm Teresa Young. I'm a senior associate at TAC. I'm a social worker by trade and have a history in substance use and homelessness programs over like the past 15 years. And I'll pass it off to Jordan briefly to introduce herself.
Awesome. Thanks so much. I'm Jordan Gully. I'm a senior consultant also with TAC, also a licensed clinical social worker. Kind of the last 20 years of my work has really focused on the overlap of behavioral health and housing systems. So everything from outreach supervisor to most recently, before coming to TAC, I was overseeing a crisis system. So very familiar with de-escalation and crisis prevention. So looking forward to engaging with you all today.
All right, we can go to the next slide. And we'd love to know a little bit about who's in the Zoom room with us today. So if you could drop your name, pronouns, and your title in the chat, and then let us know something that you hope to learn today or hope to discuss during this training. So, you know, like I mentioned, you can use the chat feature to do that, just so we get a sense of who our audience is today. And we can go to the next slide while people have a little time to get that into the chat. We'll just briefly go over the agenda. So we're going to start off with maintaining awareness and safety in community-based services. We're then going to move to trauma-informed engagement strategies. We're going to talk a little bit about how you assess a situation that may be escalating. And then we're going to get into the techniques of once that has happened, kind of what do you do, what strategies do you use, both verbal and nonverbal. We're going to practice these strategies in a role play, and then we're going to talk a little bit about what steps to take when something kind of gets beyond your skill set or your scope. And we'll leave some time at the end for questions and answer and to have a discussion. We also really do encourage you to participate and join the discussion throughout. We'll have several prompts of questions. And like I said, you can come off mute or you can use the chat to do that as well. Next slide. And after you attend this training, you should walk away with a few different skills, we hope. So one will be to review techniques to maintain safety within the field, discuss techniques to ensure that interactions are trauma-informed and that they create emotional and psychological safety, to prevent de-escalation, to review the basics of assessment during an escalating situation. And then like we said, those practical skills, learn basic de-escalation, verbal and non-verbal techniques to avoid something reaching that crisis point where it tips over into a crisis, and practice that in a role play like we mentioned. Thank you everyone for dropping your information in the chat, by the way. So we'll start off with a poll. How comfortable are you at engaging with someone who is escalating or appears to be in crisis? So I'll have Sarah launch that poll, and there's a few options: very comfortable, comfortable, uncomfortable, very uncomfortable. So kind of ranging the spectrum so we can get a sense of what people's level of comfort with this topic already is. We'll just give people a few moments to answer that. And whenever you're ready, I think we could share the results as those come in. Okay, so we have a few people that are, or a good amount of people that are very comfortable with this topic, which is great. So I hope you will contribute to our discussion today. Most seem to be comfortable, and we also have some people with, less comfort with the topic, and we hope that we can be helpful in kind of increasing your skill set and ability. All right, we can go to the next slide. Okay, so let's start with talking about basic safety in the community. So when you're out providing services, what are some things and some skills that you can bring along with you that just generally ensures safety? And that applies certainly when you're coming across someone who's escalating or escalated or in crisis, but also just generally good things to practice to establish a baseline of safety when you're delivering services. Next slide. So we're going to start off with an exercise about observational awareness. So I want folks to take a look at this photo. These are pedestrians. They're crossing a very busy street. What are the things that you notice about behaviors that may be safe or unsafe in this photo? So if you were crossing the street and you wanted to be aware of your surroundings and doing that safely, especially at a very busy intersections, what are some of the things you probably wouldn't do and that folks in this photo might be doing? Not
Not
safe on your
looking on
phone.
your phone.
Yes, thank you. That is like a very, very obvious one. That's absolutely true. You're not going to see a car coming if it's crossing the intersection. Looking down, yep, also very true. Not walking in the lines. Yes, exactly. I see some people not on the crosswalk. I also think I see someone in the bike lane potentially. I think we've covered most of them. Most of the things that I think if you're crossing a busy street, you may want to avoid. Walking with your head down, Nicole, thank you. Um, and again, this is an everyday situation. This is something we see all the time. So kind of paying a little more attention to detail about what the risks in the situation are is exactly the exercise we're trying to do today, because you can bring that observational awareness and situational awareness with you into the community as you do your work. And it's not being hyper vigilant, but it's about taking account of what's going on around you and maybe like a slightly more aware way than you might day to day if you're approaching a situation. We can go to the next slide. So I think you actually called all of these out already. So what did you notice? You noticed that people were walking with their head down on their phone, not walking in the crosswalk. Um, Other things about situational awareness that you were taking into account. Do you remember how many umbrellas were in the photo? 3 or 2? That's one of those answers is correct. Yes, very good. Very good. And was the stoplight red or green? Does anyone remember?
Hmm.
Red. Yep. Yep. I didn't notice. That just as important. It's important to notice when we don't notice something so we can practice our situational awareness a little bit more. But some of you, yep, it was red. And anything else that you observed in that photo that you want to share or that you think is worth noting?
It looked like a true metropolis, like a city.
Yes, it looked very, very busy.
And I'll just say that you guys are very acutely aware. I think we do this exercise because often when we're going through the work, or maybe we've had a really stressful day and we're not really paying attention. I think we all have had the experience of driving somewhere where we get there and we're like, oh my God, how did I get here? I don't remember the last 10 minutes of this drive. So I think we do this because often in the day to day, we sometimes get in a place where we're not aware or cute or observing interactions. And so kind of recentering, and that is always really helpful when you talk about things that might escalate, or if there is a situation escalating.
Yeah, absolutely. All right, we can go to the next slide, where we're going to talk about what some of those skills are to increase your situational awareness. So like we discussed, it's just being more observant of the situation so that you can quickly and accurately identify something that might be a problem in the future. So it's that early identification of when things might start to seem off to you. And certainly if you're not practicing your attentiveness, you may miss something early on. You might miss kind of like a subtle shift in someone's behavior. You might miss some circumstances around you that aren't the safest. So some skills to do that, the OODA loop. So observe, again, being kind of mindful instead of being distracted by like the next 10 things. And I know that you all have the next 10 things on your schedule on any given day, and thinking about that, trying to stay in the moment and be observant of the present situation that you're in. Kind of orient to what's around you, who's around you. If it's necessary, like I know one skill that we always practiced in community-based services, like, okay, like I need to know where the exit is in case something was to become unsafe. And once you have that and you've kind of read the room, for lack of a better term, or read the situation, you can decide what your next steps are and take those steps. And so that's kind of moving us through the phases of awareness. We certainly don't want to be oblivious to our surroundings. We want to be aware. And if we're aware, we can then become alerted, right? So we can, if we're aware of our surroundings, we can detect like something might be off. So now my attention is heightened to that situation or that set of cues. And then we may or may not move into feeling like there's a threat in the situation. Certainly there isn't always a threat, but it's always it's important to kind of stay alert. Next slide. So I guess I want to hear from the group, as you're delivering community-based services, what are some techniques that you use in order to stay present and in order to increase your situational awareness and be able to detect threats as they're coming up, or just detect when things are a little off? Like, what are some techniques that you all bring to your work?
I try not to do my notes at the moment. I try to do them later and focus on the client and the surroundings.
Yes, very good. That's kind of like what we were touching on about, like, you have a million other things to do in your day, but when you're with that person and you're in that moment, being present. Absolutely.
So what if we go to third?
The body language. So yes, being aware of your own body language and being aware of other folks' body language. We'll talk a little bit more about that later on in the presentation. Eye contact, right? So you want to be engaged with that person so that you can pick up on if something is shifting.
I would respond back to them and kind of reiterate what they're saying. So they know that I'm paying attention and that I know you're being clear, and just so there's no miscommunications.
Hooks you up to.
Yep. So that's being like an active listener.
But the headphone should still work.
Yes, and that's what I've always done.
Yeah.
But you see,
Thank you for muting yourself. So being an active listener and reflecting your understanding, that's important. And use your team. Yep. Familiarizing yourself with the location before meeting. I used to use that one a lot when I was in community-based services, because it's disorienting to be in a novel situation, but also like not be really aware of like where you are, or like maybe it's a neighborhood you haven't worked in before. Maybe you're not sure like what exactly all is around you, who's in the building, all of those different things that come along with delivering services in the community.
And I don't know if this was been said, but also know where your exit is.
Yes, definitely. All right, we can go to the next slide. Thank you for all that participation. I love it when people participate a lot in these trainings. And Mandy set boundaries on how far into someone's area you will go, which is perfectly timed, Mandy, because we are getting into that in under our safety protocols in just a moment. So again, we're talking about maintaining awareness. I think we do want to not like we're not looking for, like, we're not trying to make a threat appear, if that makes sense. Like, we don't want to get to that point of hypervigilance where we're always looking for a threat, because that will impact the relationship that you have with the person and how services are delivered. But we do want to maintain awareness. So exactly what someone just said, know exactly where the exits are, keep a clear path, stay alert, know if someone in the home might have weapons. If that's part of like your assessment, that's great. Or if it's something that they shared with you, it is a reality that a lot of people do have weapons of different kinds. And so that's part of your safety planning and understanding of what the situation might be, maintaining those physical and professional boundaries, continuing assess emotions. I know, like we talked about, like how we're feeling, but also talking about if you notice a shift in how someone else might be feeling and how their presentation or affect is changing. And then there's stuff that you can build into your everyday protocols. So, for example, having a safety word or a text phrase with another staff member. When I worked in community-based substance use treatment, we used to have a safety word that we could call someone with. And so, like, if we felt like something was really escalating or became unsafe, we would kind of use that phrase, and that would be a trigger for someone to come check on us. Another thing that we would do is when we were out in the community, would like, if you're going to someone's home, you keep the address of that person's home in your calendar with the appointment. So if something were to happen, folks would know where you were. So that's alerting others to your location. And you can also now look, I don't know that there was location sharing when I was delivering community-based services at the time, but now there certainly is, and you can drop your location to a colleague if you needed to do that. And that in it of itself might be someone's cue to say like, she's dropping me her location and we didn't talk about this, like, is something going on? So those are things that you can build into your day-to-day protocols doing the work. And always trust your gut. So if something in the environment or the situation is telling you that you're unsafe, make sure that you're using those protocols to make sure that you're preserving like your own safety above all other things. So if something feels off, this room, like it says, a lot of you have had experience with this. So I think when your gut is telling you something, you should listen to it. Okay, next slide. So like we talked about a little bit, we don't want to be looking for threats. Like, we don't want to kind of like make them appear out of kind of our own concern or fear of the situation. But we want to be aware so that we can detect threats that are accurately present. So when you do the work, how do you balance awareness without being hypersensitive or hypervigilant to potential threats? Which is a tricky thing to do. I know it can be tough, and we've all experienced our share of challenging situations. So how do you balance that in your work?
Okay, all right, bye.
I see in the chat focus more on preventative measures than in the moment, and I think that's great. I was just going to say that I think the other thing is knowing yourself and doing the self-care, which I know has become a little bit cliche in the field. Everyone likes to throw self-care around, but I think, having been in the crisis world where you're constantly responding to crisis, I think people become alert and they become hypersensitive to things. And so when you're yourself triggered, you sometimes are more aware of things happening. And so I think that's also an important part too.
Yeah, absolutely. I think that self-check is really important. Like, before I go into the situation, where am I at? Am I more anxious at baseline for some reason today? And how is that going to impact how I assess things? I also saw partners continuing talking to one another, and I think that's really also key. You know, I oversaw a lot of services for a long time, and if I wasn't sure about something, I would still get that consultation and be able to talk through with a colleague kind of like what my experience was, the tone of the situation. Yeah, absolutely. All of these things are things that you can bring into the work to kind of assess the situation accurately. So again, not that hypervigilance, not that obliviousness, the awareness and the alertness. Okay, we can go to the next slide. And if people want to continue to add to the chat while they think about it, that's also fine. But we will move over to trauma-informed engagement, and I will pass it off to Jordan.
Thank you. And it seems like we have a audience that's very familiar and comfortable with some of this, so we may not spend as much time on this, but I think we lay the foundation around safety in the community and trauma-informed engagement to the point that somebody put in the chat of often prevention is the easiest way to keep things from escalating. And obviously there are things outside of your control that sometimes may escalate a situation, but as much as we're acutely aware of the things that might be impacting an individual, we're able to respond or change our approach in a way. And so next slide. So in that mindset, when we talk about working with individuals experiencing homelessness, with individuals who have behavioral health, with individuals we encounter in general, we're talking about coming at it from a trauma-informed way. And so one of my favorite quotes from kind of the father of trauma-informed work, did a lot of work with PTSD, is the single most important issue for traumatized people is that they feel a sense of safety in their own bodies. And so we're going to talk a lot about safety and autonomy throughout this entire process, because I think that often happens to perpetuate and inform escalation or how somebody responds to something. So I'm curious, in your work, what are some avenues you're taking with individuals you're working with to ensure emotional and psychological safety during all your interactions? So feel free, we're a smaller group, feel free to come off mute or drop it in the chat. Just curious about kind of your approach to how you're ensuring safety of the individual you're engaging with.
The one thing I would say is validate their feelings and reiterate what they're saying,
Yeah.
just to make them feel like it's a safe space, which it is.
100%. You're going to hear that a lot of like validating the emotion. It may not be something I am experiencing, or it may be not based in my reality, but this is what you're experiencing in the moment. 100%. Checking in with them often and letting them know it's okay to take their time. Absolutely. Let them set the pace. Validating, reflecting back, and providing physical space between each other. Body language indicates that they might want more space. 100%. I feel like you guys are talking about things we're going to be talking about throughout this. So it seems like you're definitely doing some of the techniques to ensure people feel safe and engaging from the jump start. Any other techniques you found helpful in kind of ensuring safety for the individual? Right. We can go to the next slide. Feel free to keep dropping things in the chat. Asking if the space we're in feels safe and if we need to move. Yeah, so getting that feedback, creating that feedback loop of like, if you feel unsafe at any time, let's change the process that we're using. And I think when we think about trauma-informed approach and trauma-informed engagement, we often think about empathy, dignity, respect, and autonomy. And these are themes that we're going to see throughout. And I think it's themes that, based on your answers, you're all engaging with individuals from that perspective. I think, particularly knowing that individuals we're engaging with have often a litany of traumatic experiences that even engaging with another provider might be something that triggers past history and trauma for them, because we've been down this route, particularly if somebody's on outreach. Maybe I've talked to a million people and told them my story over and over again, and I'm not in a place where I want to even engage anymore because this distrust for the system that anything's going to come from it. So I think, when we think about how we engage people, it's that empathetic, unconditional, positive regard, and allowing for dignity and autonomy in the decisions. And I see that in some of the chats that are coming in, like, do you need more space? You're leading this discussion, you're steering. So making sure that they feel like they're the ones who are in control of the situation, particularly because people that experience trauma often feel out of control and they feel like the control's been taken from them. I also see in the chat clearly defining and providing structure of what the encounter is about. Absolutely. So laying expectations is a sign of respect. Here's what my plan is to work on today. Is that okay with you? Is this what you had in mind? What do you want to work on today? So I think having that conversation around the structure for the engagement, so they know what to expect, you know what to expect. It's part of the respect and allowing them to guide it through their own decisions. So next slide. So I think the other thing that we think about when we think about,
I spent like $2,000.
I think the other thing we think about when we think about dealing with people who might be escalating or moving towards crisis is that iceberg analogy of, we see maybe the anger iceberg. And this is adapted from a couple different models, but really what we think about is what we see is not actually what's happening, right? We see an emotion. So we see the in the moment observable emotion, and to the point earlier of validating that emotion, but there's always something underneath it. And often it's maybe unspoken or unacknowledged feelings, maybe unmet needs. We're encountering people who are living unsheltered. And so there's a myriad of unmet needs that are exacerbating how somebody might respond to a situation. When we're hungry, we respond completely different than when we feel, satiated and safe. And so I think that's the other part of why creating psychological safety is so important, because, individuals often feel they don't feel safe at any time. I'm always looking over my back. Somebody might break into my tent. I'm looking and making sure that I feel I'm safe. So there's always a sense of not feeling safe. So really making sure within our capacity, we can ensure people feel safe in the engagement. But I think often those unmet needs, sense of safety and security, under-addressed feelings, and then underneath that next layer, you have kind of trauma, toxic stress, attachment difficulties, kind of all of the things that all of us bring to all interactions. We're interacting in the moment, but we also have various past experience that are really guiding how we interact, how we think about things, how we might respond to somebody. I may have a certain response because I have a past history with this, and you had no idea of it, but you said the thing that just set me off. And so acknowledging often that, this is what we're seeing, but there's so much more happening underneath. And then I think the other aspect you think about is current historic and intergenerational trauma. So you think about all of the systems of oppression that might be impacting somebody's response in a moment. And sure, are they thinking, this is why I'm angry, this is why I'm escalating? Absolutely not. But that impact of like the teapot effect is still there, dealing with all of this stuff on a day-to-day basis. It kind of just exacerbates feelings sometimes. So thinking of all the different layers that are at hand outside of that first expression that we see, which is really just the tip of the iceberg. So next slide. So we always talk when we engage around examining behaviors. So I think in the moment, we're not really analyzing this person's escalated because of X, Y, and Z. We're really, okay, how do we support this person in de-escalating and coming back to baseline? But I think from our perspective, knowing the actions and interpretations of those actions. So I'm sure we all have heard of flight, fight, and freeze. And fawn, which is the fourth coping mechanism. But we think about, fight often looks like aggression, yelling, refusal, but underneath, what could fight mean? So it may be purpose or attempt to regain control. So maybe this person doesn't feel in control of anything right now, and all they can do is fight. Looking at flight, people might avoid or feel overwhelmed. And so what's underneath that? What's driving this flight behavior? And then freeze, maybe someone's self-isolating or not engaging. And it could be it's an internalized lack of autonomy. It could be that they're stopping engaging because they don't feel in control anymore. It could be, again, unaddressed trauma or concern. So from our perspective, when we engage someone and there might be escalation or something else going on, I think in the back of their mind, we're looking at things like, what are their unmet needs? What is this an avenue to get connection? How is this maybe a response to a system oppression? Is it coping with trauma? So thinking through what else might be at play that's exacerbating this situation, because it doesn't necessarily change the de-escalation techniques, but it changes our next steps and how we engage with that person, or even our understanding of kind of a situation. And so I'm curious from your perspective, because it sounds like you're all kind of doing this regularly, what are some of the things you might see when engaging with someone that the behavior could be an indication of something else going on? There, you can go to the next slide. I think it, oh. So thinking through examining behaviors, what are some behaviors that you see? Extreme mood shifts could be a pattern of thought or emotion, 100%. What are some other behaviors you encounter? Physical changes? What other things might be happening that are an indication that something else is underneath or going on?
I think one that I always would see is if someone was engaging really well for a period of time and then taking a step back, that might be a sign that something, oh, and someone put it right in the chat, shutting down. So not being as open. So maybe something feels too painful. Maybe something's going on that makes them want to withdraw from the situation. And then I always like to remind people that these behaviors in some ways are effective, maybe not in the overall scheme of what someone wants to accomplish or driving them towards their goals, but shutting down or withdrawing removes them from the painful situation or allows them to not have to confront the painful situation. And so like that it helps them feel safe in a way, even though maybe the long term that might not be the most adaptive behavior. Sometimes in the moment, it is something that worked for someone. So I always try to remember that too, that this didn't come from nowhere.
Absolutely. Smell of alcohol and the breath, changing subject. Yeah. So sometimes when you get to something where it's close to home, people will change the subject because they're either not ready to talk about it, or it's an indication that, hey, this is touching close to home, something's happened here before. So they may change the subject rapidly. I think to the point of shutting down, I think to Teresa's point, there's often learned behaviors that happen of, this is how I survive. This is how I survive. We talked a lot about safety. This is how I'm surviving in the moment because I need to make sure that I'm safe. And so I think of a great example. We used to go out on a call often for an individual who had a pretty lengthy history of being involuntarily committed. And we went out to engage him, and he had what appeared to be a gun tucked in his pants. And it didn't change, any of our assessment or anything. But once we engaged with him, de-escalated, had everything calm, he wanted to go with us and work with us. And so he got into the car. Before he got into the car, we're like, we just need to make sure we're safe. And so when he ended up, it was an envelope. He ended up pulling out an envelope, and he had said, oh, I do this so people don't talk to me. I do this so that people will just leave me alone, or I do this so that providers are scared of me and they don't want to try. And so, because we responded in a way that was same approach, we're making sure safety, we're assessing, we're de-escalating, and we're ensuring he had autonomy in the situation. What do you want to do in this situation? And he ended up saying, here's where I want to go. Before we got in the car, let's make sure everyone's safe. And that's when he was finally able to be like, you know, nobody had responded to me this way before. And also, here's this envelope. I did this on purpose. So it was kind of this moment of like learned behaviors of this is how I survive so people don't mess with me. So I think that's kind of that piece of like knowing there might be something else going on. And so when we think of examining behaviors, one of the important parts to consider when it comes to escalation is that our brain is wired in a way to survive. So flight, fight, freeze, and fawn are survival mechanisms when we feel threat. And so during a crisis, if we're escalated or we feel unsafe, all of our brain works the same way. So we have kind of the hinder brain, the forebrain, and the midbrain. And really what happens is the brain that's logical shuts down when you're in crisis or when you escalate. And so you move to that immediate emotional response where we're flight, fright, fight, or freeze, because that's how we survive. Your brain shuts all of the thinking down because it doesn't want you to be like, well, maybe did it, because it wants you to survive. And so when people are escalated, they move into that survival mode, and it's often difficult to engage in rational conversation or thought because your brain's not wired that way. And so why that's important for individuals who may have traumatic experiences is when we experience trauma, we see threat earlier, so we move quicker into survival mode. And so that's part of why we focus a lot of time talking about prevention and de-escalation prior to escalation, is because when people are escalated, they're in that survival mode, and it's often hard to have rational conversations. And so really the de-escalation is focused on bringing somebody back to baseline so that then we can have conversations about what else might be happening, or because they're not in a position to reason or rationalize when you're in that survival mode mechanism. So next slide. So examining behaviors, and I won't spend too much time on this because I know we've talked through a couple of them, but looking at what might be happening. So if somebody is rude or angry, it could be that they're hurt, that they don't want to be vulnerable, that there's sadness underneath. It could be mistrust or fear or just plain exhaustion. And so when we de-escalate, maybe then it's looking at how do we address what's underlying the behavior? How are we meeting these unmet needs or engaging them around what we think it might be a response to. And a lot of them we've kind of talked about in the chat. I see more coming in. So eye contact, not looking at someone, disengagement, we talked a little bit about, and even substance use, you know, often it's dealing with trauma or coping or avoiding an emotion. So often when we go to work with people, we're really thinking about this is the tip of the iceberg, but what's underneath? What's underneath that might be driving this, so that our next step after de-escalation is really focusing on the true need, not the response to the need. Any other thoughts or kind of experiences with that? I think for the sake of time, we'll go to the next slide.
Okay, so a big piece of de-escalation is the ability to assess kind of like what's going on in the situation and where people are at. So that is what we will move into now. We can go to the next slide. So inevitably there's a cycle of crisis, right? Crises don't last forever. And there's a time where people are functioning well. There's a time where that escalation might be building. There's kind of a critical point, which is the crisis that we're trying to avoid. We're trying to intervene before we get to the crisis. But there's also a phase afterwards where people are kind of coming back to baseline. So I think a big piece of assessment is being able to identify where the person in front of you is at in this cycle in order to know what interventions to use. So for example, prevention, right? So when someone's stable, you're having those conversations about like, what does a crisis look like for you? What has been helpful in the past? Building your relationship so that person feels like they're safe with you. If I don't feel safe with someone and I'm starting to kind of escalate or enter a crisis, your presence might actually like drive that further versus if you've established that baseline of respect, dignity, relationship, knowing that I care that the person in front of me has choices, that I'm not trying to control someone who maybe has experienced that in the past. Like if we can establish that, while folks are feeling well, then that will go a long way in preventing something that escalates in driving it into a crisis. So certainly a lot of what we're talking about today and a lot of skills that we'll discuss are when folks are starting to escalate. And we'll discuss kind of like what some of those practical techniques are. So once we've moved from stable functioning to sort of escalating, we're engaging with those practical interventions to either slow the process of escalation or prevent escalation from going to crisis. And certainly there's a different set of skills that are happening when someone is truly in a crisis, and we'll talk about that also. And we can go to the next slide. And so what are some of the things that we look for when we're trying to assess where someone is at? So one is affect. What does their mood appear to be? Is their mood congruent with what they're saying? Does it match or does it seem mismatched? What is the intensity of their mood? Like the difference between irritated and irate. Those are two different intensities, right? And is there something like, have they been escalated for a long period of time, or is this something that is recently happened? And is it something specific that seems to be bothering the person, or is it kind of like it's just a general irritability? Like we can see people in all different types of ways, but being able to kind of assess that and have a clear understanding of that is really going to be helpful. What is their behavior like? And we'll get into more specifics about nonverbal and verbal. But are they posturing? Are they pacing? Are they kind of in your space? Or alternatively, are they completely withdrawn, shut down, unable to engage, not making eye contact, or making eye contact that makes you think they're angry or suspicious? Cognitive functioning, so touching on kind of what Jordan brought up, like where are they at in their ability to reason? Has it gotten to the point where they're so upset by something that like logic kind of seems to have fallen by the wayside, where they can't really have that discussion? That will inform your interventions differently, right? And then with some of our folks who have maybe some like hearing voices or seeing things that we don't see, are they able to engage in a linear conversation, or are they unable to do that at this point in time? And then lastly, of course, there's like acute crisis, right? So severity. Are there actual safety concerns in this moment? So is it to the point where that person is so escalated that they might hurt themselves or someone else? Are they making threats? Are they making threats, but more importantly saying like, I intend to follow through with this threat? So that will kind of help you gauge the severity of the situation as well. So it's, I'm sure that this group, given that you all are pretty experienced, has heard of the concept of like imminent risk. Is there imminent risk of something happening to me or someone else or to that person in front of me, like right now? And that would, push the severity all the way to the top, right? We can go to the next slide. So again, we talked about nonverbal, but what are those nonverbal cues? So posture, that's a big one, right? If I am like leaning towards you and I'm really, really angry, that's different than if I'm sitting and like looking kind of relaxed. If my arms are crossed, that tells you something about how I might be feeling than if my arms are by my side. Facial expression, recognizing when someone's mood shifts. So when they start to look angry, are they starting to kind of like give you the side eye as if they are suspicious of you? Are they gesturing in a way that makes you feel like they're a little bit out of control? Usually when we're calmer, our gestures are like less articulated, and usually when we're like really upset, they sometimes tend to be like more exaggerated. So looking for those cues. How close is a person to you? Are they getting into your physical space or someone else's physical space? How different is this from how you usually see them? I think we all have come across folks who maybe like talk really fast or talk really loud, or sometimes even like sound baseline angry, but they're not. Like, and we all know that person. So for like that person, if they always sound like that, we might not assess that to be a crisis. But if they dramatically shifted, or if it was someone who's usually really, really quiet, and then all of a sudden they appear really animated or really angry, like looking for that shift from that person's baseline, but also making sure that you understand what that person's baseline is. Because again, we want to accurately assess this, right? So again, you might have someone who other people perceive as angry, but really like that's not what's going on with them because you know them, you have that relationship. And that wouldn't be kind of a stray from their baseline, but someone who there's like a marked shift in their behavior. They're like, whoa, like this is not how I usually experience this person. Like, what's that about? Eye contact, I think either way, right? So someone can stop making eye contact with you, and that could be a sign that something's amiss. Or someone could be making like very direct eye contact with you, like glaring is an example. And that could also be a sign that like they're feeling unsafe or upset, or that something is off in that way. Breathing, if someone is really anxious, they might breathe more rapidly. If someone's really angry, they might breathe more rapidly. And then, like, what are they saying is a big context clue as well. And are they speaking like rapidly, or are they able to speak, what's normal for them? You can go to the next slide. And so inevitably culture will come into play when we're making these assessments, right? Because certainly some cultures it's more normative to stand closer to people, and we don't want to make the mistake of assessing that as something that's wrong with the situation when that's just kind of like the approach that that person takes because of their culture. So I guess from your experiences in your work, like what are some times that has come up? Like how do folks' culture impact their nonverbal cues? I know I already gave one of the examples of kind of like proximity, like what people are used to depending on their culture, but I think there's other ones also. How loud you speak. Yeah, exactly. That's talking about that. Like if you know someone and they just tend to speak louder, then that's not kind of like a stray from their baseline. But if it's someone who generally is very soft spoken and that's a change, that's something you might want to look at. Using your hands and gestures. Personally, I use a lot of hand gestures. You might not be able to see it in this small Zoom box, but that's definitely true across like different cultures may like gesticulate more or less. Authority figures in interacting with an opposing gender. Yeah, that's a really good one. Thank you for bringing that one up. Oh, Jordan, I think you're on mute.
Sorry. I think the other one that comes up often is eye contact and interpretation of eye contact. So in particularly Eastern cultures, eye contact can be viewed as threatening, and in other cultures, lack of eye contact can be viewed as threatening. So knowing kind of where you're coming from and where the person you're engaging at is coming from.
Yeah, that's a really good point that I had not got to yet. That is like, you also have to know kind of like what your cultural norms are. So it's not like, am I assessing this in a certain way because of like the way that I perceive the world because of my culture? And, making sure that you really kind of like have your finger on that pulse, and understanding both perspectives, where you're coming from and where the person in front of you is coming from. We can go to the next slide. These were really good examples. Thank you everyone for contributing. So I know we already kind of got into this and you also gave it in your examples because this is a great experienced group. But yeah, just making sure you're considering those cultural implications. They're important and we want to, practice cultural humility and not make assumptions, and get to know that person and their cultural context. So we already talked about eye contact. We already talked about whether people are more or less animated, talking about interventions, like how someone might be impacted by the involvement of their family, or if that would be something you want to think about as an intervention. And again, thinking about yourself, how is your culture and your personal beliefs impacting your assessment? And, culture, absolutely, but also just your personal beliefs. Like we all need to check sometimes our biases and our beliefs about the work and people in front of us, and make sure that we are not letting that impact our assessment in a way that's not helpful. And also, like, what's that person's past experience been working with providers? Are there past experiences that might be impacting their experience now? So Jordan touched on this a little bit earlier. If they've worked with providers for a really long time and have gotten nowhere or have found them unhelpful or have had an experience that was not so positive, that's going to influence the present situation, especially if this is someone that's like newer to you.
And I'll just add, I think this is also to Teresa's point where like that self-reflection comes in, because I think our past experiences also impact how we assess a situation, whether we know it or not. And I think of, an individual who I supervised that we kind of processed some of the interaction, but she perceived threat and risk and escalation much quicker than she had previously, because she had had a situation where she essentially got trapped during an encampment process and felt unsafe. And, from then on in a similar situation, her heightened sense of risk was different. And so what she would have normally assessed as not a high risk, it became high risk to her, just based on her own situation.
Yeah, thank you for saying that. I think especially in this work, many of us may have experienced trauma. Like I know that I had a team, and one of the things that happened very frequently was that people would like overdose in our lobby because they may have used right before coming in. And so we were all really heightened to that. So your work experience definitely impacts how you perceive things. And always, if there are supervisors in here, and also for folks that are using supervision, like make sure you're processing that and thinking about that so that you can continue to be effective. It doesn't impact the way that you're delivering your care. We can go to the next slide. Okay, so a case example, and looking for folks' feedback on how you may have handled a similar situation or what you think you would do to handle a situation. You are engaging on outreach, and you have just finished with a resident with whom you are very familiar. As you are leaving his tent, his neighbor approaches you rapidly, comes extremely close to you, and starts yelling at you and gesticulating. You have never met this individual, but he is agitated with you. You attempt to distance yourself, and he pursues you, yelling that he has seen you around and he knows that you have been following him. How would you approach this particular situation? Or a similar situation, I guess. It doesn't have to be like this exact, but I know my work on outreach, we had one person in particular who he just perceived us as a threat for whatever reason, and it wasn't anything that you know we were doing. It's like what he believed about who the outreach team was and what our intent was, and what was going on with him. And so we wanted to deliver services. He was definitely in need. He needed food, he needed water on a regular basis. And so we had to think about what our approach was going to be. So I see in the chat, make sure I have other workers around. Yep, absolutely. That's always really important. Team can definitely provide safety.
And I
Any
think
other
in this,
thoughts?
oh, go ahead.
I was just saying any other thoughts, so go ahead.
Yeah, feel free to come off mute or drop in the chat, because I know we have a pretty experienced group in here. But drawing from what somebody said earlier too, I think it's validating the feeling while you're ensuring, like, okay, is there safe space? Is there everything? Like, this person's frustrated, they're agitated. You haven't, they haven't been following, you haven't been following them, but I'm in this area a lot. I do outreach. And so, being able to engage around the feeling, but also then like de-escalating and saying, that must be really scary for you. I'm so sorry. Like, I'm in this area because I do outreach and I was checking on one of my individuals, and like pivoting in that moment too of like, this is what we do. I'm here to help if you want help. So being able to even tell the person, you're right, I am here a lot. It's maybe not for you specifically.
I see in the chat, we keep essential needs with us during outreach, during similar situations, offering food and water, and explaining the reason for being in the area. Yes, I think if you can kind of bridge the gap a little bit by offering something that is helpful and useful, that is a really important relationship building tool. I'll never forget one situation where I had a woman like screaming in our waiting room, and we removed her from the situation with others. We kind of like calmly spoke to her, de-escalated. Turns out she was like really hungry, and she was really, really hungry. And so we sat in my office and we had something to eat. And that's kind of getting at that like unmet need. So being able to help meet some of those unmet needs with the essentials is really helpful. And also a sign like this person's here to help me, maybe. They're giving something that I need. Okay, for the sake of time, we'll go to the next slide.
So we're going to get in a little bit to de-escalation strategies, and it sounds like based on chats and people sharing, there's definitely people already using a lot of these techniques. So we'll talk through verbal and nonverbal techniques for de-escalation, and then talk through some situations. But feel free to kind of jump in with your own experience of time you've used it or times that it has or hasn't worked for you. So next slide. So when we think about de-escalation strategies, we think about communication, and we've kind of talked about this a little bit, so I won't spend as much time here, but when we think about de-escalation, we think about the 3 V's of communication. And so the 3 V's of communication are visual, verbal, and vocal. And can anybody tell me the difference between verbal and vocal? Tone, 100%. Yep. Words versus tone. That's exactly what the difference is. So verbal is what you say and vocal is how you say it. And so the reason we pull this out and talk about this is because if you notice in this pie chart, this is the kind of effective communication breakdown. So 7% of communication, being effective in communication, is verbal. So 7% is what we say. The other factors that are so important are how we say it and the visual, so the nonverbal communication. And so when we think about communication, even in escalated situations, not in escalated situations, we think about 38-55 rule, which is, or excuse me, 7-38-55 rule. 7% is verbal, what we say. 38% is vocal, how we say it, tone, cadence, volume, and 55% is the visual piece. So when we often think about communication, we feel pressure sometimes. Oh, what I say is so important. It's not really what we say, it's how we say it and what we're communicating with our body language. So I think that's really important when we think about de-escalation. So we always kind of start with that mentality. And I think it also helps with staff that are new. If you're a supervisor and you're working with someone around de-escalation, there's often, my new staff will be like, I have no idea what to say. Well, that's the least important part of this. Let's talk about what else you can do. And I think that's really helpful and comforting, particularly for new staff that are learning to de-escalate a situation, or, maybe going out on their own and I have no idea what I'm going to encounter. So I think even level setting with that is sometimes really helpful. And so we're going to spend time talking through each of these. So next slide. We'll focus first on the non-verbal piece. You can go to the next one. I forgot I put that arrow in. So really, de-escalation starts with us. And so how we react in a situation determines whether the situation escalates, de-escalates, or becomes mutually tolerable. And so one of the biggest lessons for de-escalation, and it sounds like you all have a pretty good handle on this, is learning how to remain calm. And I think particularly for individuals who are newer in the field, or for you're encountering an experience you've never experienced before, it's very common to feel a little escalated. And so it doesn't matter how we feel inside, it matters what we portray outside, right? And so when we think of nonverbal, we think both ourselves and the other person. And so Teresa talked through what are we assessing nonverbal for the other person pretty well, looking at, you know, the different eye contact and breathing and everything, but similarly, we're thinking about that for ourselves. So next slide. So we wanted to start a little bit, and I think for the sake of time, I'll skip the video, but wanted to talk through remaining calm in a situation. And so this video just talks through breathing exercises, which is really breathing in for 5 seconds, holding it 2 seconds, breathing out 5 seconds, which is something that we can do wherever we are in a way that the person doesn't even know we're doing it. That really just helps to regulate our emotions and have us be in a better headspace. So we gave two breathing exercises and then progressive relaxation techniques. And I'm not sure if any of you are using this in the field. Feel free to kind of do a thumbs up or tell me if you are. But we often use progressive muscle relaxation because if you are in a relaxed muscle state, you can't feel anxiety. It's kind of a principle that we use often when we work with people who have PTSD, because if you are able to relax your body completely, you can't experience anxiety. And so when you start to feel anxious or worried or things escalate, where's the first place for you that you start to feel it in your body?
And I just think like I've always found this so helpful in the way that it was explained to me is it's like a feedback loop. So often we think like I'm anxious, so my body is tense, but we don't think like, oh, if the opposite is true, if I relax my body, then I'll experience less anxiety, like in my thoughts. And emotions. And so how those two things kind of like work together and the feedback loop can go both ways. It's not just one way. One place that I worked, we did biofeedback. So we would assess kind of like someone's emotional state, and then we would have them go through a breathing exercise or relaxation. And you could actually kind of measure like their pulse and like different cues that would kind of show how anxious someone is, and you could see like the actual difference when someone went through one of these exercises. It was pretty remarkable, and I think it allows us to think more clearly as well if we're not in a heightened state.
And so everybody experiences it differently. So like for me, where do I feel anxiety? It's in my shoulders. Some people feel it in their chest. Some people feel it, you know, in their hands. They'll clench their hands. And so in doing progressive muscle relaxation, so I see somebody says in their chest. A lot of people feel anxiety in their chest in the beginning. And so kind of focusing in on the place you feel it first and doing progressive muscle relaxation is something you can do in the moment. And it's really just focusing on the area where you feel tense, tensing that muscle, holding it and releasing it. And then progressively working through your body. It's, you know, some people start with their toes because it's easy, clenching your toes, releasing them, clenching your calves, releasing them, and kind of working your way up until you've done it progressively throughout your whole body. And it's just releasing all that tension. And if you do that, if you start in your, you know, with your chest, your shoulders, wherever, you'll feel that it starts to release, and then you're going to go into a relaxed muscle body. And so some of those techniques we gave you on the handout really walk through this, but it's something that you can do in the moment to just kind of check yourself and regulate where you are. And it's kind of a reset. You know, I used to have staff do this in between really stressful calls because it helped reset their body, because we're carrying things with us sometimes that we don't even know. So this is just one of the techniques that you can use to kind of make sure you're grounded before you're engaging with someone, and it's quick and easy and they don't know you're doing it. So next slide. So I won't go through a lot of these because I feel like you all threw them in the chat as we were talking about some of the nonverbal techniques, but really important to think about positioning. And one of the first things that somebody talked about with situational awareness was like never going too far into the tent and knowing where that boundary is for me and for them. So making sure you're not unintentionally putting yourself in harm's way. And I think about, we worked for an agency that required us, the contractor required us to wear lanyards, and they had originally bought lanyards that didn't break away. And I was like, well, this is just a choking hazard, like very easy fix, breakaway lanyards. So thinking of things that might inadvertently become a threat, a potential threat or a weapon if things were to escalate. And then you want to avoid stances that appear closed or defensive. So thinking about those nonverbal communications, that might be arms crossed or hands in your pocket, or that face hardened and staring. So some of those things you're assessing for nonverbals when you're looking at the individual you're engaging, you're also making sure I'm not doing that inadvertently. I think about, we all have people we know that have that resting face that's just angry. And so I had, a staff that worked for me that had that, and she's like, I always have to check it because people think I'm mad, but I'm not. And so made that conscious effort to have a very open posture, open face, and then avoid kind of trying to keep things neutral. So smiling or laughing sometimes can be perceived as sarcasm, disbelief. It can quickly escalate a situation. And so making sure you're kind of keeping things neutral. And avoid getting trapped or boxed into spaces. I think that's part of that unintentionally, making sure you're not unintentionally putting yourself in harm's way. So I know we talked a lot about these previously as you guys were throwing things in the chat, so we can go to the next slide. I think the other thing with nonverbal is that supportive stance, which this actually comes from crisis prevention intervention, where somebody mentioned earlier about proximity. So sometimes personal space is different for different people. So knowing where that personal zone is and standing at a safe space, kind of at a 45-degree angle with your hands. In this picture, they're completely up. I think, if they're down by your sides and you just want your hands open so they know you don't have anything, because anything could be perceived as kind of a threat. So next slide. And then just avoiding demonstrations of power. So thinking through in the moment, is there an opportunity for me to remain at the same eye level for them? I used to oversee a program that did overnight outreach during hypothermia alerts. And the quickest way to make somebody escalate really quickly is to wake them up when they are warm in their tent and ask them if they are okay. But that was kind of our job, was to make sure that, nobody was ill prepared for the weather. And so in those situations, we're already in a position of power because we're standing over people while they're sleeping. And so, is there an opportunity to level the playing field a little bit? And if it's not being able to get to the level with them, then it's, maybe stepping back further away from them so that you're not hovering above them. Avoiding the same things that we interpret as threatening, gesticulating, sudden movements, pointing, and want to make sure we avoid touching people and staring. So we've talked a little bit about a lot of this, so I won't spend a whole lot of time on it, but I think just making sure we're slow and intentional in our movements, and then that supportive stance, which is really at a 45-degree angle, at least an arm length away, maybe a leg's length away. We had an individual we knew, he kicked when he was angry, and so we always stayed a leg's length away and that one leg back, so that if you need to move quickly, you're already in a position where you're not standing kind of flat-footed. So I think a lot of these we've already talked about because you all are obviously experienced in doing some of this work because they've been dropped in the chat, but wanted to talk through some of your own nonverbal positioning too. So next slide. So we're going to do a quick video, and just based on the interaction, if there's anything that you would change in this situation.
Someone's been in my bedroom cupboard and I know who it was and they took it. I want a doctor.
What's the matter, Ben?
I've just been on leave seeing my mum, haven't I, right? And I come back and I've gone to my wardrobe and my phone's been nicked and I know he's taken it, I know he has.
Okay, you're going a bit too fast for me, Ben. Why don't you sit down and take a seat?
I don't want to sit down, I want him to give me my phone back. He's taking it to wind me up.
Who took it?
Philip.
How do you know he took it? Have you got any proof?
I know what he's like. He's always nicking stuff and I'm going to fucking do him.
Did you see him take it? Did you see him go anywhere near your cupboard?
I've been with my mum, haven't I? I mean, he had 3 hours. That's when he must have done it.
Well, did any of the other patients see him take it? I think we should ask first of all, don't you?
I don't know.
Have you looked anywhere else apart from your cupboard?
Look, he took it. I know he has, and I want him to give it back. And if he doesn't give it back, I'm going to do him, and I'm going to smash his place up.
Well, let's just ask the other patients first to see if anyone's seen it.
No
did you
fucking
take
way.
it
I
home?
know he.
Let me finish. I was about to say, did you take it home with you?
I didn't take it out.
Look, Ben, you're most probably upset because your leave's over. Lots of people...
No, fucking not. Philip's got my fucking phone.
But you don't know that, do you?
Don't tell me what I fucking know and what
That's
I don't.
not what I'm trying to say.
Yeah, what are you trying to say then exactly?
Look, I'm just...
Don't touch me.
Look, calm down.
No,
will
you calm down.
Oh, this is ridiculous.
What? That I've had my mobile stolen? You think I'm lying? Is that it? Is it?
I think you can pause it. So there are ample things that went wrong in that video. Just curious, based on kind of your reflection, what you would have changed or what you think escalated the situation. I see in the chat, as a worker, I would not have remained seated or crossed my arms. I would not have said, let me finish, or calm down, or raised tone and voice. 100%. I think the body language was very closed. You're right. He interrupted. He paced and escalated with him. Tone and making assumptions, touching him, telling him what to do. Not a rational, not an attempt at a rational conversation. Why did he let the person escalate him? Absolutely. Yeah. He matched the escalation step for step. At one point, you literally see him physically roll his eyes. Any other observations? I think this is quintessential what not to do, both verbal and nonverbal. And a lot of them you pointed out, he interrupted, let me finish, didn't really give him control, and he challenged, not validating the client's suspicion. Didn't validate it, challenged him. Oh, it was probably this. Are you sure it wasn't this? Rather than saying, you're right, that's really disorienting when you lose your phone, and I would be upset too. Let's figure out what we can do to make this better. It was, oh, that's probably not what happened at all. You were just mad because you're about to leave. So not validating suspicion, not letting him name even the reason, but saying this is why it is, rather than, letting the person guide the conversation. 100%. Think we can, so all of that are what not to do. So moving forward, we'll talk a little bit about what other things you can do in situations like that. So next slide.
Okay, so now we're going to talk a little bit more about verbal techniques, and probably it will be the opposite of everything that was done in that video, because I think probably every thing that we have hit on so far, that person did kind of the thing you shouldn't do when we're discussing that category of intervention. So we can go to the next slide. Okay. So, we've already touched on this, that the most important thing is actually how you say something, and the least important thing is the exact content of what you say. So the tone, the cadence, and the pace of how you say something conveys a lot of information, right? So I can say the exact same thing twice with a different tone, and it could mean and come across two totally different ways, and that is very important. So we need to be aware of that when we're approaching a situation, because if we unintentionally say something with a tone that's perceived as disrespectful or hostile or threatening, then you're participating in escalating that situation, right? So always being respectful of the person's feelings. So even though maybe we don't think we would feel the same way in the situation. That is how they were feeling in that moment. So whatever is going on is so important to them that it is making them feel escalated in that way. And we need to be respectful of that and not dismissive of that. We saw that in the video. He was like, no, you're just feeling that way because of this. And not really kind of like validating or acknowledging how they were really feeling and how they upset they were. I don't think he said anything about that at all. He just kind of said, calm down. You don't feel this way because of the right reason, or, what have you. So when we're with someone, we're tailoring our verbal and nonverbal responses based upon the knowledge of the person and their history. So that could be some of those cultural considerations that we talked about. Or Jordan brought up the gentleman who sometimes kicked. Or, I certainly have worked with some folks who just feel crowded easily for whatever reason, whether they have, or I would say particularly folks who've experienced incarceration have communicated to me that it's very easily felt that they feel crowded or trapped. So making sure I'm giving more space than I might in another situation, or like if they are in a tent, that I'm not crossing that threshold and that I'm not the person that's blocking like their exit from the situation, because that can all escalate how someone's feeling if they're already feeling anxious at baseline. And can certainly touch on some of like their past trauma and past experiences when they felt out of control. And when we're de-escalating a situation, we want to kind of like help that person regain the feeling of in control instead of moving towards kind of crisis where they really like lose some control. Also making sure that you're having conversations. I think if we think back to that graph, right? So there's that piece of the graph where it says people were stable or they returned to baseline, having those conversations ahead of time about what might be triggering, having those conversations to understand their history and trying to avoid those in your interactions, or at least be cognizant of them so that you're not unintentionally triggering that person with some of the ways that you're responding, and really kind of like focusing on the present moment. And then, of course, taking intentional steps to reduce trauma and re-traumatization. I think one of the biggest things that we need to be mindful of is that often folks sleeping outside that we might interact with are already facing a lot of judgment, a lot of stigma, a lot of people making decisions for them, even like where they're allowed to sleep or if they're allowed to keep their belongings. And we don't want to be a participant in that. It's like I said earlier, you don't want to be the person that they perceive as unsafe, because then you cannot be effective when you're de-escalating a situation. So making sure that you are giving them a sense of control, you're giving them choices, like there's multiple ways to proceed through this and what feels right for them. Respecting that autonomy and dignity are all, things that can avoid kind of re-traumatization. You can go to the next slide. And so just some practical strategies for verbal de-escalation. So we want to remain calm, like Jordan was talking about, so that we can move that person from escalation back towards like to stability. If we think about that graph again, we want to listen more than we're talking, I think is really important, because that person is feeling like they have something they really need to express strongly in that moment. We're reflective listening. We're letting them know we're heard. That can look like validation sometimes. That can also just those active listening cues. And validation. I can't express that enough. Again, it doesn't have to be valid to you. It is valid to them. It is what they're experiencing. And you can validate that without kind of like, so for example, for someone maybe who's hearing something that you can't hear, and or experiencing some thoughts that maybe aren't quite based in reality, you can still validate that by saying, that must be really hard. That must be terrifying. That sounds really scary. Without necessarily saying like, yes, that's happening. You can still be validating. Or like, maybe you don't understand why someone's so angry about X, Y, and Z. Maybe you don't know them well enough to know their history or their background. Doesn't matter in this situation. You can still validate that. I can see that this is making you really angry. So always, I feel like I've heard it put like validation can kind of take the wind out of someone's sails in a sense, in like a good way, right? So saying like, no, I hear you. Like I could understand why you feel that way. It already is bringing kind of that person closer to baseline, because I think we know people escalate when they don't feel like what they're saying is being respected or listened to, or if it's not coming across. You can go to the next slide. So just a few things to avoid and things to do. So avoid attempting to reason. We talked about how that part of the brain is literally shut down. That's not going to get you where you need to go. Minimizing, like I said, you might not experience it or see it as important as they do, but they are experiencing it at that level of importance. So minimizing is not going to help you. It's going to make someone feel dismissed. Ordering, directing, or demanding how to do something. That doesn't give someone choice. If someone's already feeling out of control, we want to give them choice to kind of reestablish some sense of control, right? We don't want to be the ones in control and further taking control away from that person. Interpreting or analyzing behaviors in that moment. Perfect example in that video. You're upset because you were on leave and you've come back. You had to say goodbye to your family. Not helpful. Not helpful. Not the time. Sometimes when someone comes back down to kind of stability, maybe you can debrief, but definitely not the time when someone's in crisis. Questioning too much or probing, again, that part of their brain is not necessarily online, so they're not going to be able to respond well to a line of questioning very well, and it might just feel kind of like those rapid fire questions might feel like a little bit hostile or overwhelming when they're already overwhelmed. Withdrawing or attempt at distraction, not redirection, but like kind of in that paternalizing way where it's another way of minimizing in some ways. Don't meet them with their tone or tempo, and in fact often what I would practice is actually talking more softly and slowing it down a little bit just to make sure I'm not meeting them there, and then certainly not engaging in a power struggle. We can go to the next slide. And then a few do's, and again I think we've probably gone over some of these. Validate again. Remove the audience, super important. Not, I don't like to say like people want an audience, like that's not what that's about, right? It's that people might feel out of control and then they might actually feel like embarrassed to be having that experience in front of other people, and that escalates the situation further. So you want to get them into a location where they're not compounding like how they're already feeling, which is bad, by feeling embarrassed that they're doing this in front of others when they might kind of like, we don't want to be out of control in front of others. Do address the person's concern. Again, that's that not minimizing. And, give the person space to express themselves so long as they can safely do that. But also kind of like while you're working towards redirecting, options, giving choice, and just maintaining consistent and calm response to how that person is escalating. So you are kind of trying to bring them back down to where you're at versus escalate the situation further. We can go to the next slide. Okay. And so this is kind of summarizing it in like a little acronym that might be helpful if folks are new or learning these skills. So listening, empathizing, asking questions within reason, reflecting back. So those are all ways to say like, hey, I hear you, and like I'm with you in what you're experiencing, and slowing down the pace. And then to continue de-escalation, you can validate, you can defer, you can suggest alternatives, or you can give a positive prompt. And so especially using that when it's not like a need you can actually meet in that moment, right? So someone might be escalated over X. Well, you can't solve that problem for them, but you can still validate what their experience is. We can go to the next slide. Okay. So again, a little bit more about the verbal techniques, and we have talked about this. What do you say and how do you say it? So someone comes to you kind of like in the situation that we presented. Why do you keep harassing me every day? I hear you are frustrated that I'm interrupting your day, but part of my job is to ensure people are safe when it's cold out. Or if someone has the belief that everyone is trying to kill them, or they have some beliefs about what others are trying to do them, we come across that with some regular frequency, right? Validating the emotion. I can see how this is stressful for you. How can I make you feel safe? Yes, I want to increase your feelings of safety. I don't necessarily want to reinforce that your neighbor is putting gas into your vents, because we don't have a reason to believe that that's true, but we can acknowledge that that person is feeling unsafe because of that, and we can talk about ways that they can just increase their feelings of safety. If someone's agitated, talking extremely fast, and escalating in that way, you can kind of use strategies to slow them down. So saying, hey, like, I'm trying to follow what you're saying. I care, communicating, I care about what you're saying. Can you slow that down a little bit to make sure that I can get what you're trying to tell me? You can go to the next slide. Okay, and this is kind of using verbal techniques, like the things that we just covered, and some that you bring into your own work. How would you respond to this situation? So you have to, and I suspect that we've been in this role, many of us at different times. You know that encampment cleaning is coming. You're not the person doing the encampment cleaning, but you are going to tell folks because you want them to have an opportunity to collect their belongings. You don't want their things to get displaced. So you're informing someone of that, and they say, you don't give a F about us. You just care about optics. If someone comes by here, I'm gonna, you can say, do them, like the gentleman in the video said, but like basically threatening harm, right? How would you handle that? Or have you actually come across that in your work, and how did you handle it in a way that felt effective? I know one way, like, I've had to approach it is like, I don't want to make it worse, right? I don't want someone to get hurt because they're coming to the encampment to do what someone has asked them to do. But you can still acknowledge that it kind of stinks. You can kind of say, like, yeah, it's terrible, and it's got to be like really, really hard that you don't have a place to keep your stuff that's safe because people keep asking you to, move your belongings. That's really, really, really tough. But like, so what can we do now to get your stuff together so you can kind of like preserve what you do have? So trying to, shift into supporting them, but acknowledging that it does stink, because it does. It's an unfortunate reality that people are facing.
And I think that's similar strategy to the one where you offer water and diffuse meet the basic needs. So I think it's aligning. You're right, 100%. This is annoying, it's frustrating, it's infuriating, but I just want you to know because it's happening, it's outside of my control, and I want to make sure you are aware so that you can take appropriate measures.
I see in the chat, lead with being there as a preventative measure. Right. So, you are not the person that's carrying out the encampment, but saying, like, I want to do this so that you have an opportunity to get your stuff. I don't really have control over what's going to happen next, but I want you to know so you can decide what to do next. And providing items they may need. Yeah. Or stuff if, unfortunately things have already begun and they've lost some things, that can really diffuse the situation. Let's do one other one, I guess, just for the sake of time instead of all of them. So what about encountering someone on outreach who is yelling incoherently, so things that aren't making sense, and it's mostly to themselves or kind of just to the air, and gesticulating near others but not engaging with them? Have you come across that situation before, and how did you handle it? See, keep a safe distance, hands where they can see them, ask their name. I think the water and sandwich situation has served folks well in that if, you're able to approach the person, if, approaching with something that they might need can be helpful. But I think some of that would, come down to assessing kind of like where that person is at.
Yeah, just piggybacking on that, I think the key piece is often assessing and like keeping safe distance and even asking their name. Are they able to engage in a conversation? Are they so escalated in a different place that they can't acknowledge my existence? So I think even asking their name is a great way to, like, sometimes people will immediately snap out of it and start talking to you. Other times they may not be able to. So that helps you gauge where are we in this level of escalation.
Okay. If there are no other thoughts, but if there are still, feel free to continue dropping them in the chat, but we'll just move to the next slide for time. So this is kind of after you've achieved a little bit of de-escalation, right? Because you're not going to get into kind of like the logical planning, thinking stuff if someone is like up here. So you've kind of validated, you've stayed calm, you've brought them back closer to baseline, and they're able to focus. That part of their brain has come back online, so they're like no longer in crisis. So then it's time to talk about, like, okay, we've experienced this crisis, we've gotten back closer to baseline. So like, what do we do to prevent this from escalating again moving forward? And again, that autonomy and respecting choices and really listening to folks about what works for them is key here, because you don't want to be engaging in planning that is not useful for that person. So you could make a plan to follow up. Should I come back and check on you today, or do we want to touch base tomorrow? It's been a really tough day for you. Is there someone else on the team that you want me to reach out to? Or like, are there steps right now that I can help you with that can make you feel safe? I think of some folks that I worked with who did believe certain things. Like, I had a gentleman who believed that a neighbor was coming into his apartment and dropping bugs in his apartment. So we talked about, like, okay, so like, what are some things that could make you feel safe? And one of his ideas was just to put a shoe in front of his door, so if it opened, he would hear it. And like, was the neighbor really coming in and doing that? No, we don't think so. But he really believed that, and this is something that preserved that sense of like psychological safety, like Jordan was talking about at the beginning of presentation. And that went a long way in de-escalating the situation over the next few days, because he felt like he had something in place to keep him safe. What additional resources might a person need in that moment? And then certainly, like, if you make a plan, follow through, because you want to be that reliable, safe person that they can feel is someone that they can turn to during escalation, and that will be there to support them. Okay, we can move to the next slide. Okay, so we're going to revisit this video, but this is, you'll see how things are going differently, and then we'll talk about it afterwards.
Someone's been in my bedroom cupboard, right? And I know it was, and they took it, and I want to see a doctor.
What's the matter, Ben?
I've just been on leave seeing my mum, haven't I? And I've just come back. I went straight to my cupboard, right? And someone has taken my mobile. He's been in there, and he's taken my mobile. I know he has.
So who took it, Ben?
Philip.
Did you see him take it, Ben?
Well, how could I? I was on leave, wasn't I?
Of course. What sort of mobile was it?
It's a Nokia, and it's got a camera. I only just got it.
A Nokia? You must be really angry, right?
Yeah, well, I didn't want to come back anyway, right? But I do, and I see someone's nicked my mobile, right? And I've had it up to fucking here.
Yeah, I can imagine. Listen, why don't we find somewhere to sit down and we can work out how best to get your mobile back, yeah?
Well, yeah, but we can't just sit down. We've got to go talk to Philip.
Why don't you come with me? We'll find somewhere quiet to sit down and talk about your mobile.
No, we've got to go back. We've got to go and talk to Philip and look in his cupboard. He's nicked it.
It's the best thing.
But
I'm
I
just
didn't
taking
even
him
want
into the quiet room.
We need to go and talk to Philip.
Let's have a seat, Ben.
I don't want to see it. I don't want to see it.
Okay, Ben, I'm going to sit down. Are you going to join me? We won't be interrupted here. So tell me what happened.
Well, it's like I said, right? I'm on leave and I'm seeing my mum, and then I come back here and I go at my cupboard and my mobile's got, right, and everything else has been like trash. I mean, for fuck's sake, you do not muck about with other people's cupboards. It's just wrong.
Quite right, Ben. Your cupboard is yours and yours alone. Listen, This might sound like a stupid question, but I've got to ask it.
Well-
Are you definitely sure you left your mobile in the cupboard?
Yeah, I don't take it out in case I lose it.
Okay, okay. And you were saying you thought that Philip took it?
Yeah, to wind me up. He's always winding me up.
What made you think it was Philip?
Because I know what he's like.
Okay, have you spoken to him?
No, I couldn't find him.
Okay, we can speak to him later. Did you need your phone now for a particular reason? Did you need to call someone?
No. But my mum might have texted me.
Right. So we need to get your phone back as soon as possible, don't we?
Yeah.
Do you want to call your mum? You can use the phone here.
No.
Okay. So how long were you on leave for?
3 hours.
And was it just with your mum?
Yeah.
So what did you do?
We went for something to eat.
Okay. And what did you have to eat?
What was that? I had steak pie and chips, and then I had chocolate brownie.
Was it good?
Yeah, it was. It was really good, yeah.
So you had a good time then, did you?
Yeah, but it's only 3 hours, isn't it?
Do you wish you had longer?
Yeah, of course.
So how do you feel about being back here now then?
Pissed off.
I can imagine. Lots of people find it quite hard coming back here after they've been on leave.
Yeah. But what about my phone, though?
Good point. I tell you what, I don't know if it's right to confront Philip yet, until we've had a good look for your phone. Do you agree?
I bet he done it.
We'll do our best to find your phone for you. First of all, let's double check and make sure it's not hidden somewhere. Is that a good plan?
I suppose so, yeah.
Well, where do you suggest that we look first?
I think
I
we can
could take
stop
you to
the
my cupboard.
video
That's a great idea.
here. So clearly they've gotten to a point where they can have a conversation about planning what to do next. So before they got there, what are your observations about what this gentleman did well to de-escalate the situation? Because he was able to successfully de-escalate until they could start planning and having a deeper discussion about what was going on, right? But that doesn't happen until after we're de-escalated, right? Because we don't do that while we're de-escalating. So what are your folks' reactions? Listen, literally the opposite of everything they did last time. Yes, that's true. Remained calm. Validation, better tone. And the directions, like they weren't like sit down. It was like more of like why don't we? And so that like provides some level of choice, right? And when he said, I'm gonna sit down, he didn't say you also have to sit down. He left that in the other gentleman's hands to make that decision.
I think the other thing I note, because I do this often when I de-escalate, is he was like, I'm gonna ask a stupid question. So like I need to ask this question just to evaluate, but also like I acknowledge it could escalate you, and it's not that I don't believe you, it's this is what I need to ask in the moment. So I think often even adding caveats to things like this may seem dumb or it may seem obvious to you, but here's something I need.
Yep. Yeah, absolutely. There's been many a times where I'm like, I have to ask this question. And I know you may not want me to ask this question, but I have to ask this question, especially if we're doing like a risk assessment where we really think someone's at risk. And you might get the information like, yes, actually, I do really want to go hurt myself. Or you might get the answer you were kind of looking for and saying like, no, like I'm not actually going to do it. And that tells you a lot of information about kind of like the acuity of the situation. We can go to the next slide, but yes, absolutely. Like he did a completely opposite of what he had done previously, and you can see the effect that that person had on that approach had on the person in front of him. So now we are going to do breakout rooms. I'm going to read this, but it was also a handout. So you have been working with John for several months and have a great relationship. You have been assisting him in getting his ID, and you have an appointment today at Vital Records. John has been homeless for 4 years, and he has never been diagnosed with anything, but you have observed signs that he experiences auditory hallucinations. Though you suspected, he only recently told you that he uses meth. During the past few engagements, he has been distracted, more easily irritated, and has told you the neighbor has been harassing him. He does not disclose what that means when you ask. As you approach him today to take him to Vital Records, You see him removing everything from his tent. He appears agitated, as evidenced by his erratic gesticulations, rapid movements, and elevated volume. When you engage him, he tells you that someone broke into his tent and rummaged through his belongings. As he is talking, he stops and engages with someone unseen, then turns to you more escalated and yells, "It was my neighbor. I knew it. I need to go over there and take care of him." So when we break out into the breakout rooms, we're going to ask for volunteers to be the outreach worker and to be John, and to role play how you would de-escalate this situation.
I've just opened all the breakout rooms, so you should receive a prompt on your screen.
Well, welcome back. Welcome back, everyone. I think we wanted to just do a quick debrief and see kind of how that experience was. What techniques were you able to utilize that felt like it was effective in de-escalating the situation? I know in our group, we talked a little bit about obviously validating the feeling. This is based on a real experience where the person's tent had actually been ransacked. And so once they were able to kind of de-escalate the situation, then offering like outreach supplies. So what can we do to replace the items that are gone, and acknowledging in the moment, I know it's not the same. It's going to be different because it's not your stuff. And, you feel a certain level of violation when someone comes into your space and takes your belongings. But, in this moment, we're able to replace those basic need necessity items. Anything else that people found helpful or useful in kind of engaging in that process?
I know in my group, they did a really good job of not minimizing how challenging that experience was and what it meant for that person. And I think that was really helpful and validating also.
We can go to the next slide then. And next. So kind of beyond de-escalation. So I think, it seems like everyone in the room is pretty familiar with basic de-escalation strategies, and has the mindset and mentality and really engages in these techniques regularly, which is not surprising. I feel like I use them all the time on outreach when I was doing outreach, but I think there are times obviously where it's beyond de-escalation. So though uncomfortable, many situations can be managed using all the techniques that are outlined today, that it sounds like was a little bit of a refresher for a lot of our attendees today. But anger, yelling, agitation, history of substance use, aggression, even, suicidal ideation aren't explicitly emergencies in and of themselves. And so knowing how to kind of respond, how to assess, how to engage is really helpful. But we do know that there are often situations that are outside of our role, your role, and knowing, you've tried all of the techniques and this person's still escalated, or you've exhausted all the techniques, you've consulted with your supervisor, you're kind of like, they're still escalated, things are still happening, new information surfaces that maybe impacts your ability to assess and engage around safety. So I feel like this happened so often, of I would engage a person and then maybe walk away and a team member had other information about things that had happened, or I'd walked away and the neighbor said, "Oh, this has also been going on." Maybe they'd been, in physical altercations recently, or, and so it's not just the escalation in this moment that's been resolved, but there's been over the course of weeks and months, somebody has been escalating and you get more information. We environmental changes. So obviously with working with people who are in encampments or unsheltered, weather-related concerns can impact the resolution of a situation. So, it's going to be cold weather situation and this person's tent has been damaged and they're, escalated but not willing to address the issue that they no longer have somewhere to stay in shelter. And then thinking somebody might be unresponsive. So knowing kind of imminent risk of acts of violence or someone's at imminent risk. We've tried all of these techniques and there's still kind of an active threat. So next slide. So just kind of knowing when it's outside of the scope of de-escalation and knowing, what I've done everything within my parameters and I'm not, what's now because this person still escalated, things are still happening. I think, obviously when in doubt, always consult. We, Teresa and I were talking recently about this and she's like, I would always call a colleague and be like, is there anything I haven't thought about? I think even as seasoned clinicians, there's situations where you just want to double check or consult with someone. So consulting and figuring out what other opportunities or what other techniques can be tried. I know someone in the chat said, if there's other outreach team members, doing the work I've done for various years, there were some people who just were escalated by me and it was a me situation. And so bringing a partner in de-escalated the situation and let somebody else work with them in a more effective way. And I think knowing local area resources, so knowing access to mobile crisis, if there's crisis respite, what are the other options that we can do to ensure there's a trauma-informed approach and trying, at all costs, all of us are trying to engage in all of those least restrictive measures to ensure that we don't need to call 911. We don't need to call a police officer. Let's explore what the other options are. And we've talked a lot about as much as possible planning ahead. So for individuals who are engaged with making sure there's kind of a crisis plan in place that allows someone to identify when I'm in crisis, this is what I need to happen. And so in that moment, you're not planning with them. They already have specified, this is what I want to happen. This is a sign that I'm in crisis. This is a sign that it's beyond de-escalation. And so that's a way to give them kind of autonomy in the process so that if something happens and you walk up on it and you already have, we have a plan about this is what they wanted to happen, so that they're able to have autonomy in that situation where maybe they're not in a place to have that to make that decision for themselves at this time. They've already made it. They know what they want to happen. And then I think things like this, engaging in continued learning, advanced techniques for de-escalation, and then handling behavioral health emergencies. So sometimes it's an emergency and not a de-escalation or a crisis. It's reached that point of emergency. And so how do we as an agency or we as an individual handle these situations and knowing what the resources are and how do we closely coordinate with those systems while hopefully having that plan in place where they've already identified what they want to happen. So next slide. I know we are almost at time. We wanted to leave a little bit of time to just see if there were any questions. Teresa and I can stay on for a little bit, but we know there's a lot of techniques and it seems like you guys are pretty advanced in doing some of the de-escalation techniques. So we really appreciate the participation and engagement around ideas. I think we also have a poll for feedback too, sorry. So Teresa and I will stay on if there are any particular questions or scenarios, but Sarah, I think we can do the poll if you want.